So thank you to those who have joined. We're just going to wait a few more seconds while our participants all join in. It'll just be a few more seconds. Thank you. Good, so here we go. Welcome, everybody. Good morning, good afternoon, good evening, wherever you are around the world. It's a pleasure to have you with us today, joining us live. And also welcome to those who will be joining in to our recorded version of this as well. My name is Professor Ian Bates. I work with FIP as the director of the Workforce Development Hub and also director of the Global Observatory. And I'm really looking forward to our presentations today, and just as much looking forward to the questions and comments which you, our audience, will be writing in as well. So FIP has a well-established and very ambitious vision of a world where everybody benefits from access to safe, effective, and quality medicines. We are super keen on ensuring equitable access to medicines expertise, no matter what country or what region our civil societies are located in. So our mission is to support global health by enabling advancement of practice, advancement of pharmaceutical sciences, and of course, advancement of workforce and education, which is the sort of focus of today's webinar. So we're very pleased to be delivering this event, one event in a huge program of delivery that FIP is stewarding throughout the remainder of this calendar year. And this event is our event 1.7, which is enabling our workforce and supporting ongoing competence in the field of immunization and vaccination. Some housekeeping first before we get into it. We are being recorded and it will be available on the FIP website, which is located at www.fip.org. We're also being live streamed via Facebook as well. We encourage you to ask questions or to raise comments, and there is a Q&A, a question and answer box at the probably at the bottom of your screen where you can do this. And if you put your questions into that box, we will make sure that we filter them out to the correct, to the right panelist, maybe all the panelists perhaps, and we will try and we'll try our utmost either to get a written response to you that everybody can see, or an oral response from our panelists. There is a chat line going as well, and we'll be monitoring both the chat line and the Q&A box throughout the session. Please also, if you're not a member of FIP, have a look at our registration page as well at www.fip.org. And there's a membership item on the front of that page. We have thousands upon thousands of members worldwide, and FIP has direct links and memberships with over 140 countries worldwide. It is a very vibrant and a very influential organization. So I'm attempting to moderate this webinar today. I'd like to introduce my colleague and friend, Professor Ralph Altieri, who will be helping with your questions and your comments and bringing them to the fore. Ralph, would you like to say a couple of words of introduction?
Yeah, thank you, Ian. So again, welcome everybody who's joining us live today. And again, to those who will be viewing the recording at a later time. I'm Ralph Altieri. I'm the chair of FIP Education. So that's the education arm of the FIP organization. I also serve as dean of the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences in the United States. Happy to be co-moderating this session with Ian today. We did one yesterday. Very well received, good audience participation. So again, if you have any questions or comments, please put the questions in the Q&A box, and other comments you can put into the chat room. So good to be here. Looking forward to today.
Thank you very much, Ralph. This series of programs, which is transforming vaccination with a regional and global focus, is the first FIP transformation outcomes-based online program of its kind. No one has attempted to do this before, and this is all underpinned now by the FIP development goals, which were officially launched about 2 weeks ago by FIP. The final outcome of this program, this series of events, will be a historic global FIP commitment to action on vaccination in pharmacy. And you certainly don't need me to tell you how timely and opportune this is right now. This collection of events is all available on our website and represents a huge effort and expenditure of energy by FIP to get this to you, but already it's proving to be very influential. This series that I'm outlining is running from September to December this year. Series 1, of which today's seminar is part, focuses on identifying the needs of our practitioners, our pharmacists, and pharmaceutical science workforce on delivering vaccination transformation. Series 2 of this program is discussing the actions required to deliver on the needs identified in Series 1. So it's a progressive program, as you can see. And all of this will be aligned to the FIP Global Development Goals. And Series 3 will focus on our FIP member organizations. These are the professional leadership bodies located in every country across our 6 global regions. And we'll be looking at how our leadership bodies in a wide range of countries have addressed and will address these actions on the commitment to transform vaccines globally and regionally. We urge you to engage with us and to help us to answer these questions here and these global challenges. The things which are most interesting and driving us at the moment with FIP and our member organizations are the factors which needs to be prioritized in order to transform vaccination services globally and nationally. Additionally, what would be the most important achievement in terms of pharmacy vaccination services in our individual countries over the next 5 years? And our final big thematic component here is what else should our FIP commitment to action outline? So these are the big questions, and next week we have a summative webinar which will attempt to start to draw these questions together. Today's learning objective is about trying to showcase and to define changes to existing workforce development strategies. Our driving philosophy is that we can have no pharmaceutical services without a workforce. So we do need to pay attention to our workforce, making sure that our existing pharmaceutical workforce are ready to deliver vaccination and immunization services. So today's episode is enabling our workforce, Our panelists have expertise in education and workforce development and will showcase their ideas to you all in order to stimulate discussion and to provide exemplars. Our main outcome for today is to define and quantify changes to workforce development strategies and make sure that we keep a focus on the workforce development to enable vaccination delivery. So I come to a point now where we just have to check that our first speaker is ready. We have had some, so Amateo has had some connection problems, which we are resolving in the background. So we've changed the order slightly, and we are super pleased to have with us Mitch Rotholtz from the American Pharmacists Association, who is a nationally recognized expert on pharmacy-based immunization delivery. Mitch, we're so looking forward to hearing from you. Your biography is super impressive. You've served as secretary for the Joint Commission of Practitioners. You currently serve on the National Vaccine Advisory Committee. You have demonstrated super strong leadership for the Steering Committee for the National Adult and Influenza Immunization Summit, the Advisory Board on the Immunization Action Coalition, and the Adult Vaccination Working Group. We couldn't have asked for a better expert. And I would like also to point out that you worked on numerous projects across professional boundaries between pharmacists and physicians, leading to improved patient care outcomes in the field of vaccination and immunization. So I'm going to hand over to you now, Mitch, for your presentation. And I will hope that we have a couple of questions for you at the end of your presentation before we move on to our next panelist. So Mitch, I'm about to hand over to you. Thank you for joining us and giving up your time with us today. Over to you.
Thank you, Ian, and thank you, Ralph, for the work on this project, as well as the FIP team. And thank you for inviting me to be with you today. So I've been asked to talk about what we've done within the United States to support pharmacist engagement within immunizations. So I'll try to run through my slides quickly so we have time for questions. So going back to pharmacist training. So we've been working on immunizations for role of pharmacists for over 25 years. And we developed a certificate training program in 1996, where as of December of 2019, we have trained more than 360,000 pharmacists to administer vaccines across the lifespan, and not only just to administer it, but to become a knowledgeable resource in the communities that they work in, so that we could expand the reach and understanding of the importance of vaccinations in our communities. And it goes back to the role that we identified from the very beginning when we entered into this activity, is that we wanted pharmacists to serve one of three roles, or all three roles. One is as an educator, a facilitator, so working with other healthcare professionals to bring access to vaccinations closer to individuals, and in the states where pharmacists have the authority to actually administer the vaccines. And so to support this, we had to have a training program that gave the pharmacist the knowledge, the skill set, and the confidence to do this activity. And so we created the education program. We reached out, as Ian said, we've been reaching out outside of pharmacy, because immunizations is a team activity. And so it's not just one healthcare profession's role to take responsibility for. It's actually the team. And so we're actually back in 2012, after working in this area for a while, APHA coined the term immunization neighborhood. And it really focuses around 3 C's: collaboration, coordination, and communication among immunization stakeholders to provide vaccine preventable, to immunize individuals against vaccine preventable diseases, as well as protect our communities from those diseases as well. And that has really stood the test of time of bringing together individuals who work in immunizations to focus on the needs of that patient, the needs of the community, and keep that focus as we move forward. And it helps take away some of the barriers of turf battles that typically occur as different healthcare professionals are trying to identify their role on the healthcare team. And so we use that for immunizations, but you can really use that for any type of activity you're trying to work on to improve public health. So we've created the education program, we had a national faculty, but to hit that 360,000 pharmacists trained, we couldn't just do it alone as APHA. And so we partnered with colleges of pharmacy, state pharmacy associations, pharmacy corporations to train the trainer. So we train individuals to deliver the vaccine program so that they can train individuals in a consistent, standardized way. And so that's how we've become, that gold standard in the United States is we've got the core standards, the core delivery process, and then we've trained individuals to deliver it in a consistent manner. And so we've engaged also our student pharmacists early in their careers. So colleges of pharmacy have licensed the program to train their students while they're in school, because in the United States, student pharmacists have the opportunity to actually administer under the supervision of an immunizing pharmacist. So we have extra support, again, experience for the students and extra manpower to deliver vaccines and increase access to communities. And so getting those students involved early in their career gives them a skill set, but also gives them embeds in their thinking the importance of immunizations. And that is carried through as they've gone out into practice, where they're looking for jobs that allow them to immunize. And now employers are looking for individuals who are willing and able to immunize as well. So both sides have come together and have also driven this role for pharmacists in the United States. And then when you get involved in immunizations, it's not just a one-time thing. It's not a training and then you just move on. You have to make a commitment to keep up on the recommendations, a commitment to serve public health and to support each other in this activity. Next slide, please. So as I mentioned, we did create a certificate training program. The slide that will be coming up hasn't shown up on my screen yet, but it talks about what are the components of the training program. It's a 20-hour training program that includes self-study, so it gets a baseline for everybody coming into the actual live program, and then a live program. And there's assessments that go on throughout the training process. Now, COVID's given us a little twist in terms of that live component, but we've been able to innovate in a way of getting individuals to be able to demonstrate the hands-on ability to provide immunizations. We've also converted some of the live training to also virtual training. So it hasn't stopped us from training individuals who still haven't gotten the training, but we're doing it in a different way than we did pre-COVID. Also part of the training, as I talked about, is the hands-on, as well as having CPR certification, and also keeping a commitment up to when things change in terms of recommendations, making sure that the trained pharmacists have that information. So we provide ongoing education and information to the immunizing pharmacists so they can keep up with the information. Next slide, please. So as I talked about too, we've embedded the training program in our pharmacy student education so that it's now part of the ACPE standards that colleges and schools of pharmacy are accredited to. Those standards now include the important role of public health in pharmacy practice and education. And so as you can see here, I pulled out the language where it talks about earning certificates in immunization delivery and other public health focused skill sets. Our students, when they come out of school, already have that training and are ready to play a major role in their communities. Next slide, please. So as we did the training, this led to an opportunity, and COVID really was we were ready in terms of having pharmacists who were trained. We had them able to play roles in current COVID situations. So for example, pharmacists were tapped and asked by our government to participate in COVID-related activities. We were identified as essential healthcare workers to maintain continuity of care, not just in other chronic disease management activities or the continuity of care for people unrelated to COVID. But also during this time of COVID, the big message from the government is everybody needs to be up to date on their needed vaccines. So having access points where people were not comfortable going into medical clinics or outside of their home, the relationship that they had with their pharmacists, of being able to educate them and provide access to ongoing immunizations is playing out today. As right now we're in the United States, we're in the flu season, so that pharmacists are playing a very important role in increasing the access for individuals to getting their flu shot. So that's the one thing that individuals can do today while we wait for a COVID vaccine, is make sure that they're up to date on their recommended vaccines, including influenza vaccination. So pharmacists are busy today providing influenza vaccines. And that has really set the stage for our government to actually change some of its policies. And in the United States, the authority for pharmacists is controlled at the state level. So we don't have necessarily a federal practice act for pharmacy. But in emergency situations, the federal government has the authority to issue rules, regulations, and opinions that basically override restrictions at the state level. And so they did enact 2 of those recently in regards to pharmacists and immunizations. The first one is we were seeing a decrease in childhood immunizations occurring due to COVID. Again, as I talked about, people are hesitant to go out into their medical providers to get vaccinated. So one authority gave pharmacists the ability to immunize children 3 to 18 years of age for any recommended vaccines. And so our training program, as I talked about earlier, trained pharmacists across the lifespan. So they were educated about childhood immunizations, adolescent immunizations, adult immunizations. So that role that the government put us in, we were able and ready to take advantage of that when it was appropriate. The second authority that came was authority for COVID vaccination. When COVID vaccine is available to be administered, pharmacists have the authority to administer it. Now, we will provide additional education related to each of the vaccines as they come out, but pharmacists don't have to go through any additional process for administration of vaccines education, just the nuances of each of the vaccines that are going to come to market. And so we're ready and able to step up and serve as important players in COVID vaccination. Next slide, please. And so this is my last slide. And really the message I want to put here is that through training and thinking ahead, we thought we could have easily started out just focusing on, say, flu vaccination or just adults. But very early on, 25 plus years ago, we decided that we wanted to train for the vision. And the vision that we had was that pharmacists would play an important role, just like every other healthcare provider in the system, for increasing access and the administration of vaccines in their community. And so that training has really stood the test of time, and the vision has really played out in that we have pharmacists in the United States who are positioned to play that important role in COVID and beyond. And that has taken a lot of effort from the APHA and the profession, in that keeping pharmacists up to date on immunizations, making it a part of our strategic focus, our strategic plan. Those have all played to where we are today, ready and able to provide COVID vaccination. So that's my last slide, Ian, and I'm be willing to answer any questions.
Mitch, thank you so much. That was very, very informative and comprehensive. I'm just going to pass over to my colleague Ralph now, just to maybe provide a bit of interrogation for you before we move on to our next speaker. Ralph, over to you for a moment.
Great. I have 2 questions for you, Mitch. One of them is, well, you've clearly trained over 360,000 pharmacists. What would you say the percent of pharmacists that have been trained is now in the United States? It's got to be close to 80 or 90%, yes?
I would say it's probably, Ralph, it's probably about 90%. We still have, believe it or not, we still have pharmacists who still haven't been trained. So for example, you know, in the independent pharmacy sector, we probably have 80% of that sector who has been trained. For the larger pharmacies, the chains, I would say it's more than almost the high 90s, almost 100%, because it's part of the expectation for pharmacists in those practice settings. 360,000 includes pharmacists coming in and out. So we have 300,000, according to our national boards of pharmacy, who are licensed in the United States, but we've had pharmacists who retire and new ones coming into the profession. So that's why we have 360,000 versus 300.
Yeah. So the other question has to deal with maintaining competence. As new types of vaccines appear, and we just see from the COVID vaccines that are under investigation now, the new ways of developing vaccine versus the traditional methods of doing so. Is that being incorporated into the program now for that sort of the education piece for the pharmacists so they could answer patients' questions?
Great question, Ralph. As I talked about, this is a long-term commitment that we have made for this area. And so we are doing webinars, we are doing educational articles and information. So as new things come out, we are providing that to our pharmacists, whether they're part of the association or not. It's available to everybody. The key is that you keep up with it, and it's part of the standard. Actually, what guided all of this is we developed early on pharmacy-based immunization guidelines, which includes the commitment to ongoing lifelong education. And the recommendations change in immunizations all the time. And we actually have a representative on the ACIP, which is our advisory committee on immunization practices. We have a representative of APHA who sits as a liaison official on that. And so they are providing quarterly updates, webinars for pharmacists to, again, keep them up to date. But we are on top of any new developments. We have a webinar ready to go. We are ready to go when COVID vaccines, we get the information about them, and we will be developing educational programs for that pediatric opportunity, while pharmacists in their main training got that training in that program. We also have a refresher course for those that want to refresh their information. So it's really for all the folks that are on this webinar, it's not just a one-time training. It's a commitment to ongoing, continuing professional development.
Super good. Thank you so much, Mitch, for that. And thank you, Ralph, for those questions. Let's, with pleasure, let's move on to our next presenter, Dr. Han Zi. Dr. Han is a lecturer in the Department of Pharmacy at the National University of Singapore, one of our great global universities, and a principal clinical pharmacist. She has studied at the University of Michigan, the University of Chicago, and she is a very forward-looking, very progressive practitioner in medicine and infectious diseases at the Neng Teng Phong General Hospital in Singapore. So, Dr. Han, it is with super pleasure that I hand over to you for your presentation. Thank you.
Sure. Thank you for the kind introduction. Good evening to everyone from Singapore, and depending on where you are around the world, very good morning or good afternoon. It is my pleasure to be able to share with you on enabling the pharmacy workforce, specifically in Singapore, and what we are currently doing to support national efforts at the National University of Singapore. So the slide that you see here provides a quick snapshot of pharmacists' roles with immunization in Singapore. I would not go into too much detail on this slide because the president of the Pharmaceutical Society of Singapore has been invited to share with everyone the current landscape in Singapore at one of the FYP webinars earlier. So certainly if you are interested in what we are currently doing, that would be a resource that is available to everyone. But what I do like to highlight from this slide is that currently pharmacists in Singapore are very much involved in doing vaccine advocacy and facilitating the administration of appropriate vaccines, particularly in the acute care sectors. And moving forward, as our nation's healthcare system is transitioning from a more traditional acute care focused framework to more of providing care and maintaining health in our community, our community pharmacists are actually very interested in stepping up as an immunizer role, which would definitely also support our national goals in terms of increasing vaccine uptake rates, especially among our adult patients. And in order for this transitioning of roles to happen, we are currently working with our legislators and our Ministry of Health to overcome certain barriers and implement changes in terms of legislation and infrastructure to allow pharmacists to step up to an active immunizer role. If you can move on to the next slide, please. So another critical component of pharmacists stepping up our roles as active immunizers in a community setting is, of course, to enable our workforce to ensure that we are competent in our vaccine knowledge and also in vaccine administration skills. And traditionally, vaccine administration is not part of the education and training framework within Singapore. So very recently, we have started to implement vaccination training for our currently practicing pharmacists. So this training program is provided by the Department of Pharmacy at the National University of Singapore. And to provide all of you with a bit of background, so the National University of Singapore, or NUS, is the only institution for pharmacy professional education in Singapore. And we are also the first licensed partner with the American Pharmacists Association in Singapore. And we have been delivering the APHA pharmacy-based immunization training program since the middle of last year. Come on to the next slide, please. So some of this information Mitch has already shared with you during his presentation earlier. In addition to the standard coursework that is provided by APHA, which includes a 12-hour self-study modules, which we typically provide that information to our participants about a month prior to the live seminar date, so that they are able to complete the modules and pass the self-assessment questions before they join us for the live seminar, as well as a hands-on workshop to assess their injection technique. And also to, I think, to emphasize, because in Singapore, the vaccine recommendations, the products available, as well as the payment framework definitely has some differences with the United States. And therefore, in delivering the vaccine training program, in addition to the standard coursework that's provided by APHA, the National University of Singapore does adapt the content. We do introduce additional information to ensure that the information that we are delivering to our workforce is also relevant to our own jurisdiction. So far, the participants for our vaccination training program are practicing pharmacists, many of them from the communities, as well as the acute care sectors, and some of our long-term care facilities as well. Many of them are in the process of working with our Ministry of Health to pilot pharmacy-based immunization services, and therefore they are very keen to for this training. And in fact, I can say that in the last 2 workshops that NUS has offered, both of these workshops are actually oversubscribed, and we are not able to actually accommodate all of our pharmacists. And most participants also shared with us that they do plan to start their own pharmacy-based immunization service within the next 12 months of completing this training program. And next slide, please. And this slide here is to emphasize on the enabling of the future workforce, which are our current undergraduate student. So currently in Singapore, pharmacy education is at the undergraduate level, and NUS offers a 4-year Bachelor of Pharmacy program, and we just actually underwent a major curriculum reform this academic year. So what you see here is our curriculum framework for the Bachelor of Pharmacy program. And I'd like to draw your attention to the infection prevention and treatment module in the 3rd year. So moving forward, our plan is to deliver the pharmacy-based immunization program to all of our undergraduate students in their 3rd year. So this will also enable our future workforce to be ready to be immunizers when they graduate and enter the workforce. And this is the last slide that I have, and I will be happy to take some questions from the audience or from our moderator. Thank you.
Thank you so much for that presentation. We will possibly take one question for you right now, Zay, if that's all right. So I'm going to
definitely
ask, yeah, I'm just going to ask my colleague Ralph to chip in with that right now.
Nice presentation, Han. And I think that's a good example of using some training programs that are out there and available already, and then adapting it to your specific needs, which is a great thing to see, and really pushing forward this public health issue on immunization. The training of practitioners, what's your reach into that so far, and the plans for going forward to get most of practitioners on board with the immunization training and then actually doing it? I know you said that most said they would plan to start one sometime within the next year. And maybe specifically, given the timing of where we are in the world now, how does this relate to the potential COVID vaccine administration? My assumption is, but you can answer this, is that pharmacists who are trained will be providing whatever COVID vaccine is available. Would that be true? Or do you need special legislation for that? The overriding question, I might add, because we heard this in yesterday's session and we're hearing it today too, is the advocacy piece for getting scope of practice changed and legislation, if needed, and rules and regs in practice. How is that playing out in Singapore?
Sure, thank you for the question. So currently, I guess this question is not specifically related to COVID vaccine, but all vaccines in general. Like I've mentioned, our community pharmacists and the pharmacy sector is working with our Ministry of Health. There are some legislation changes that needs to be implemented in order to allow pharmacists to step up to the role of the immunizer, because currently within our legislation, there are some limitations to our ability to do that. So that hopefully would be something that gets relooked within the next couple of months. And in terms of the reach of the workshop so far, last year and earlier this year, we have had 2 runs of the workshop and trained somewhere between 20 to 30 pharmacists in total. The COVID situation in the last couple of months has made it very much challenging for us to conduct these workshops, particularly for the hands-on component.
Yes.
But as the situation is much improved in the country right now, we are looking at offering the second run of the workshop beginning next January. So that will be additional opportunities for our pharmacists to be trained, and definitely there's great interest on the ground as well. I'm seeing questions coming through the chat.
Yes, on the Q&A.
Yes, on the refresher course. Yes, this is something we at NUS is thinking about as well, because we are aware that the skills that you learn from vaccine administration, especially, I think if you don't, you are not actively immunizing, you don't use that skill, you tend not to be very confident. So we are planning to set up a refresher course, especially for the hands-on administration part, which I think is the area where most of our pharmacists feel less comfortable in.
Do you see the second question there? I think this is a really good one because I think a lot of people on this call would probably be interested in this. When you started the program using the APHA training program, did your trainers undergo training from APHA?
Yes, so the faculty trainers underwent the APHA pharmacy-based immunization training course, just as all participants did. Additionally, there is APHA offers another faculty training workshop to make sure that the faculty has additional knowledge and skills about the program. Yes.
Great.
Super good
information.
Yeah, super good. Thank you very much for that, Dr. Han, and Ralph's questions as well. That was a super presentation. I'd like to move us on now, if I may, to Amateo Laaye from Nigeria. I will confess that we've been having some connection problems with Amateo. So I'm just going to give a very brief biography and to ask her if she is finally with us online to go through her slides with us. Amateo is one of our super young practitioners in the world. She's already had experience in community and hospital pharmacy and is beginning to build her career in public health. She studied at Obafemi Awolowo University in Nigeria and is continuing her studies in public health at the University of Glasgow. She's a member of the professional development team of the FIP Young Pharmacist Group, YPG. She led the World Immunization Week campaign from YPG. She's also the Global Antimicrobial Stewardship Intern with the Commonwealth Pharmacists Association and a trainer who has pioneered and facilitated many public health campaigns in Nigeria. Amateo, I don't know how you managed to fit all of that in to your professional life. You're obviously very committed to applying your expertise as a pharmacist and public health professional. And we're super honored to have you on the call. I just hope that we've managed to get you virtually online. So here's hoping. Amateo, are you with us? So for the FIP team, I'm not hearing anything. In which case, what I will do, since we are recording this live, we will very quickly have a look at Amateo's slides so she gets acknowledgement for these slides. And we may ask her to independently record a presentation for us, which we will tag on to the end of this FIP online recording later on. Amateo was going to alert us to the fact that there are a wide variety of initiatives taking place, both with and without regulatory authorities. And there does seem to be variance around the world now about how engaged competent authorities are, regulators, with vaccination and immunization training programs, in actual fact. And that's something we ought to be looking at, I think, from a global perspective to get a better picture and pattern of what's going on. Something for our summative seminar next week. The next slide also shows us from the perspective of workforce, what needs are being identified by countries. Amateo was going to have a focus on Africa for us, particularly Nigeria, who, of course, where she works. But we can see from this slide here, there's again a variation in how training is organized and delivered, and again maybe is prompting us to have a think about whether we ought to be looking at some global guidelines to help all of our countries to progress in this area. Additionally, I think the next slide shows something quite important. We've got naturally a focus on COVID and SARS-CoV-2 as a viral agent right now, but let's not forget that vaccination and immunization does cover a wide variety of public health interventions and inputs, and Africa in particular, and sub-Saharan Africa, has a much broader focus for immunization than perhaps some other parts of the globe. So it is important, I think, to keep a context on the pharmaceutical input into immunization. It's a much broader and an increasingly broader spectrum of public health interventions we should be alerted to and focusing on. And I think finally, Amateo was going to give us some insight into our younger practitioners and our early career practitioners, which if anyone knows about the work that I'm particularly interested in with FIP, having a focus, a global focus on our early career practitioners, I think is an imperative. And we need to make sure, not just through initial education and training, so pre-licensing or pre-registration, but those first few early career years are absolutely imperative to get our workforce up to speed. Amateo, I know, is absolutely passionate about advocacy, public health campaigns, and the involvement of early career development in public health campaigns, research, and vitally effective leadership. And all of us need to ensure that our nations and our NGOs and our professional leadership bodies are effectively engaged with leadership. And I'm looking forward next week in our summative webinar in this series 1 to be maybe talking about some of the political issues around immunization and some of the citizenship educational challenges we may be having with vaccination as a whole. So Amateo, I'm sorry you couldn't join us live today, but we will get you recorded and added to this particular presentation. So I'm looking at the time, and we will be coming back to some questions to our other panelists in a short while. I would like to maybe take us to a slightly higher level of summative thoughts and insights before we finish off our presentations today with some questions. And that is looking at what's going on at WHO level. And FIP have been providing some very direct and expert input into a very comprehensive and impactful global competency framework for universal health coverage. Everyone on this call will be aware that UHC, with a particular focus on primary healthcare, is a global challenge. We are part of this new initiative, which will be launched by WHO before the end of this year, for looking at trans-professional education and training for universal health competencies. And this means a much more systematic approach to addressing population health needs through competency-based education, which FIP is absolutely signed up to as a mission objective. And this is an attempt to try and organize healthcare training across professions to encompass broad-based competencies with both the regulated professions and the non-regulated mid-level cadres, and in particular the community health workers we have across the world. The next slide shows us that we do have alignment with this in FIP. So the recently launched FIP development goals, of which there are 21, each of them having an element of workforce and education, practice, service delivery in particular, and pharmaceutical science associated with them. We have immediate traction on at least 4 of these, if not more, when it comes to immunization and vaccination competencies. Obviously, goal number 16, communicable disease, but also access. So goal 18, access to services and medicines, and integrated services, goal number 7, making sure that we are working together in communities to provide broad coverage and universal health access. And finally, impact and outcomes, making sure we've got a good grip on immunization and vaccination services will lead obviously to high impact and high positive outcomes for our communities. And finally, before we come back to our questions for the panel, I'd like to draw attention to the recently relaunched and refreshed global competency framework from FIP, which is aimed in particular at those early career years. So something that Amateo was very keen for us to emphasize. And the fact that built into this broad scope of practice framework, this global competency framework for early careers, we have direct reference to pharmaceutical public health. So vaccinations are incorporated in that. And of course, a cornerstone of pharmaceutical care, making sure that we have good immunization status as part of medicines, histories, and medicine status for our patients out there. So we are on the ball, I think, with FIP, and we do have some good tools and frameworks already established to help us move through. And our 2 presenters today, Mitch and Zay, have given us some clear examples of training, early education, and workforce development that will help us to globally and universally start to achieve this high impact service delivery. So Ralph, I'm about to hand over to you for 5 minutes now to help us, to guide us through some further questions and comments from our audience before we close today's seminar. So maybe Ralph, if you could ask our panelists maybe some specific questions which have come up on the chat line.
So we have 2 questions, 2 areas that I think are both very important and relevant to the participants here. One has to do with managing vaccine hesitancy. We had some discussion of that in yesterday's session, but it'd be good for perhaps both of you to talk about that in terms of the pharmacist's role, I guess, in educating in people about the need for vaccination and promoting it, because we know we get so much news on the other side of how vaccines are not good, they cause all of these other problems, stay away from them, so on and so forth. So this vaccine hesitancy issue is one, and the other one, which I think is probably going to be important for a number of places, which is your suggestion for starting a vaccination education training program and service by pharmacists in countries where there are no regulations on this issue at this point in time. So how would you suggest those folks get started? So those two issues. Mitch, maybe we'll start with you first.
Okay, thanks, Ralph. So in terms of vaccine hesitancy, one of the things that pharmacists have that other healthcare professions don't necessarily have is access to the public, readily accessible to the public. We also have that trusting relationship with our patients. And so in our experience, that has played well as an extension for our public health departments because of our training and knowledge in immunizations. And we can honestly say that we do get probably more training than other healthcare professionals in the system. And so that was a selling point for us working with our public health departments, again, to extend the education and outreach, as well as the delivery of immunizations. And so even during this time of COVID, where people are hesitant to go out, we are encouraging government policy to not drive patients away from practitioners who they have a trusting relationship with, but to take advantage of that and utilize that relationship.
Yes.
And in terms of your second question, starting where you don't have regulations, we didn't have authority in every state when we started. But what we felt is if we educated pharmacists and have them knowledgeable about immunizations and encouraging them to engage with their community, if their communities had immunization coalitions, to get involved in that, that gave us the opening in the door to get pharmacists engaged in public health more than they were today. And so we've trained pharmacists, and we've told pharmacists, take your training when you go and talk to decision makers and other healthcare providers to show them the extent of that education. And that has proven well in strategy to get a pilot project started, to demonstrate the value that pharmacists can do, and then expand it from there.
Great, thanks. Han?
Yes, I will echo what Mitch has said about the access that pharmacists have to public, particularly for pharmacists in the community sector. I think that public fronting role is very important, which also makes vaccines more readily available and more convenient for patients to get. The struggle that we have in Singapore is that as a country, we actually have a very high vaccine uptake rate for our pediatric patients.
Nice.
So looking at our national childhood immunization program, we are upwards of 90%. But the percentage is much more disappointing for our adult patients, which I think their regular follow-up with a healthcare provider could be a reason that contributes to the challenge. So I think having our community pharmacists be that more accessible and convenient point of care where patients and individuals in the community can have access to vaccination would be extremely important. And the second question on countries where there are no regulations on pharmacists involved in vaccination, I think pharmacists are stepping up to this role, having the adequate knowledge and skills to advocate for ourselves would be extremely important, which I think ties in nicely to the workforce enablement that we are talking about here in this webinar, today. And I think embracing and leveraging on the changes that is occurring within your own jurisdiction is important as well. For instance, in Singapore, the current push for pharmacists to be immunizers, we are definitely leveraging on the country's shift towards providing more healthcare in the community setting. We are also leveraging on the fact that not only do we want to take care of sick patients, but we are trying to move beyond healthcare to health.
Yes.
Yeah.
Great.
Super
Well,
good.
Thank you so much. Yes.
Thank you,
Good
Ralph.
insights.
Yeah, super insights. You're absolutely right. Thank you very much for that. Great. So I said right at the start of this presentation, we will take exactly 1 hour, and we have done 59.5 minutes. So I'll quietly congratulate myself for that. It's not to do with me, of course. It's the super FIP team who are in the back room organizing all of this, to whom we need to give our thanks. Thank you all so much. It's been a very high attendance. We've had thousands of people following this online on Facebook. Thank you very much. My thanks to Mitch and Zay and Amateo for your global expertise in this. It's been very gratefully received, and thank you so much for devoting your time and energies. Next week, we have our finale of Series 1, where we have some very high-level leaders on a panel. President of FIP, CEO, Dr. Duggan, and some eminent leaders of the boards and sectors in FIP. So I can see on the chat lines that there are links to register for this event, which is free. I would urge you to do so. This is going to be a very stimulating and at times, I suspect, exciting, if not provocative conversation. So do please join us then. Ralph, shall we say a joint cheerio to everybody who has joined us today? And thank you all very much for participating.
Yes, thank you so much.
Lovely to have you with us. Thank you all very much. Bye. Goodbye for now.
And join us next week.
Indeed.
Yes.
Goodbye for now.
Bye-bye.